Hello, and thank you for joining us today. I'm Helen Normoyle, and I'm here with Dr. Clare Spencer, and we're the co-founders of My Menopause Centre. In our last video, we spoke about the perimenopause, and today we wanted to focus on the menopause, and over the next 5 minutes, give a really good 101 on what the menopause is. So Clare, let's start with that as a question. What is the menopause?
Yeah, I think that's a great question. It's actually quite complicated to answer. There's more to it. So the menopause is really a transition that starts in the perimenopause. You move through to the menopause, which is defined as end of monthly periods, when your periods have ended for more than 12 months. And then there's the postmenopause, and that really is the rest of your life after the menopause. So it is more of a transition than a definite one point in time in terms of symptoms and how women experience it.
Okay, and then I guess a lot of women are wondering, when does this start? So if the perimenopause is the first stage of the transition, very briefly, when does the perimenopause typically start?
Yeah, so the age can really vary. So typically mid 40s can be earlier than that. And the perimenopause is really the time when your ovaries start winding down, when your estrogen levels can fluctuate up and down. You stop having that nice, even, rhythmical up and down flow of estrogen. And the estrogen levels basically generally drop. And that's why you can start to experience symptoms of the menopause in the perimenopause. It's the start of the transition. And then the menopause itself, the average age is 51 in the UK. And that's really defined as I said before, the end of your monthly periods. So that's defined as being 12 months from your last period. And then the postmenopause thereafter. But your symptoms can start right at the beginning and can go on far beyond the end of your periods.
So how long can symptoms actually then last? Because again, I've heard from some people, they think that they might last just 6 months or a year, but it's actually a bit longer than that, isn't it?
Yeah, no, that's right. So typically on average about 8 years, not always 8 years. And some women it'll be a lot less, some women it will be a lot longer. A small percentage of women go on having, say, hot flushes for 15 years or more. And I know you've heard me say before,
Yeah.
I've got women in their 70s and in their 80s even in my menopause clinic, seeking help with symptoms.
Yeah, I know that's one of the things that really surprised me, and I'm definitely experiencing that myself in kind of year 4 or 5, I think, of hot flushes and night sweats, and thank goodness for HRT, but we'll come to that in a moment. But I guess that means then that symptoms continue after you've gone through the menopause. So when you're in postmenopausal life.
Yes, that's absolutely right. So, again, just going back to, although it's quite a hard scientific definition, isn't it, that the menopause is defined as that point in time that is 12 months after your last period, actually, that's completely irrelevant of your symptoms. Symptoms can start way before that point in time and can go on way after that point in time. So hence it's easier to think of it as a sort of a transition of your body adapting to its new changes, to its new status, if you like.
Yeah, and I think when you explained that to me, that was one of the most important insights, because in my head I thought, right, I'm going through the menopause, it'll be over when my periods have stopped. And then everything will be hunky dory. And actually learning that it's not, it is a much longer transition period. And so really needing to understand that has helped me enormously. So hopefully it's helping you if you're listening to this as well. Now, one of the questions then is, how will I know that I've actually gone through the menopause if I'm taking, say, a form of contraception, say I'm using the Mirena coil, and I'm actually not getting any periods anyway? Are there any tests that I can take, Clare, or are there any things that I can do that would help me understand that I've actually gone through the menopause and I'm now postmenopausal?
Unfortunately, there isn't a test to find out if you've been through the menopause. It's a really good question though. If you're not bleeding because you've got a Mirena coil, or for example, you're on the mini pill, then it's impossible to know if it has been a year since when your last period would have been, if that makes sense. It doesn't really matter that you don't know in terms of how you're managing the symptoms. So the treatment options are just the same. The support that you need can be just the same as if you did know. Although I completely appreciate it is nice to know what's going on in your body. You feel like you've maybe got a little bit more of a handle on things. The reason why there isn't a good test is because in the start of the menopause transition, in that perimenopause, your blood test can really vary day to day. So on one day, you might have a blood test that would indicate, yes, you're in the menopause. The next day, actually, your estrogen levels might be fine again, and the blood test would look as if you're not in the menopause. So blood tests can be confusing and unhelpful for most women. The only time that it can be helpful is to try and work out how long you need contraception for. And your doctor can talk you through that. But basically, if you do have a blood test for something called your FSH level, it's follicular stimulating hormone, you could have that blood test. And if you're over 50, if that blood test is raised and you're not bleeding because, say, you've got the Mirena or the mini pill, it indicates that you then need to continue using contraception for another full year. So I've said blood tests aren't helpful in diagnosing when you're through the menopause. That's right. They may be helpful if you're trying to work out when to stop using contraception. Does that make sense?
Yeah, no, that's really helpful. Yeah. And I think, is my understanding correct that if you're over the age of 55, then that the guidance and the guidelines then are you can stop using contraception after that age?
Yeah, absolutely. The chance of getting pregnant after that point are virtually zero. So everybody can stop contraception after the age of 55. It can get a bit confusing because some people are using the Mirena for contraception as well as part of HRT. It's a super convenient way of getting one of the hormones that you need, the progestogen. And if you're using it for contraception and you're using it as part of HRT, the Mirena does need rechanging after 5 years. So yeah, just a slight point of difference there, but you're absolutely right, Helen. 55, you can stop using contraception.
Yeah, brilliant. Thanks, Claire. And obviously, we get lots of questions about the symptoms of the menopause, and you've already said symptoms can start in the perimenopause, they can extend into the postmenopausal life. What are the key symptoms that you see? What are the symptoms that surprise people when they experience them?
Oh, yeah. So as you'll have seen from our website, hopefully the symptoms of the menopause are wide and varied, and basically fall into sort of physical types of symptoms. So everybody's heard of hot flushes and night sweats. They'll be experienced by 8 out of 10 women. There are other physical symptoms like joint aches and pains, like palpitations, dry skin, dry eyes. Some lesser known symptoms like the feeling of creepy crawlies all over your skin can be less well known about, or burning mouth syndrome as well. I've spoken to a couple of women this week who've been experiencing that. There are psychological symptoms which really hit people for six. So out of the blue anxiety, out of the blue sort of low mood, flat mood, people feeling they're losing their confidence, losing their mojo, their va-va vroom, and really struggling to maintain function and crack on like they used to be doing with some of those symptoms. And then there's symptoms that can relate to sex. So loss of libido is really common, over 50% of women, and vaginal dryness can go hand in hand with that as well, which is also really common. So sorry, it's a long answer, but there are so many symptoms, and so many people often don't recognise that symptoms are related to the menopause transition. I think it's good to highlight the breadth.
Yeah, no, I think that's really helpful, Claire. And I think that separating them into physical and psychological is really helpful, because I think a lot of people are surprised by the psychological symptoms. So raising awareness of that is great. And then last minute, then I suspect we might have gone over 5 here, but what are the key ways to treat the many different symptoms of the menopause?
Yeah, so it's going to be different for every single person. I really truly believe that menopause management is not one size fits all. And so I think increasing awareness, Helen, we did that great piece of work, didn't we, with Britain Thinks, that showed actually if you're prepared for symptoms, your experience of them is much better than if you're going into this blind. So it's worth arming yourself with information. There's lifestyle changes that will be relevant to some people. So upping your exercise, stopping smoking, looking at alcohol, which can make hot flushes worse. Some people prefer talking therapies. You know, there's really good evidence behind cognitive behavioral therapy, for example, and even helping physical symptoms of the menopause. Some people like to look down herbal routes. We've got information on our website. Just have to be a bit careful. Just because it's herbal doesn't necessarily mean to say that it can't have a bad effect on you or that it is effective. Sometimes knowledge is a little bit lacking around some of those remedies. There's medication that isn't HRT that your doctor can prescribe and can help with some of the worst symptoms. And then there's HRT. HRT isn't necessarily for everybody, but we know it's the most effective way of managing your symptoms. There'll be women for whom it's a little bit more risky, who need to talk it through with a doctor, but it's definitely having a look at HRT as an option.
Yeah, definitely. And we've, done lots around HRT. So we've got videos on our social posts, and you've written a ton of really great information and advice about HRT on our website, and a great blog busting some HRT myths as well, because we could spend hours, I think, talking about HRT alone, and it is where we get most of the questions. But Claire, that was fantastic. Thank you so much. A really great session again with you. And thank you for joining us today. Bye-bye.